Some of the clinical placements that you will undertake are actually on campus. So we have a number of clinics within the St. Lucia University of Queensland campus. So we have a musculoskeletal and sports injury clinic. So here we get a number of different patients who are athletes, younger patients, and also masters athletes. A number of different services are offered to patients. So some of them are coming with an injury. And we also have a service where people can come get a bike fit if they're keen cyclists. So it's not always people who are injured. There are other services available where physiotherapy plays a really important role. We also have the Neurological Aging and Balance Clinic. And so, as the name kind of suggests, this is for people who have a neurological disease. So they may have had a stroke, they might have been in hospital for an extended period and then are having community-based treatment or outpatient treatment. And so UQ can offer that kind of facility for these patients. They would come fairly regularly to group classes, or they might have individual sessions. And so within these clinics, students can play a role, or final year students, I should say, can play a role in treating these patients whilst they're being supervised. We also have the Healthy Living Clinic. And so this is just a short way outside of the university campus. So in a place called Toowong, it's just the next suburb on. And so this is a facility for community-based older people who are keen about looking after their health and fitness. So it's somewhere where they can come and exercise. They can get an exercise prescription from an exercise physiologist who works together with physio, psychologists, dietitians, so all the multi-professions who are studying at UQ. And this is kind of the pool together to kind of create this the healthy living facility for older people. And we also have a pediatric physiotherapy clinic, which again comprises individual assessments and treatment sessions for children, and also group classes as well. And so lots of common conditions that we'd see here. So children who have developmental issues, lots of children with conditions like cerebral palsy. So this is where we can come and get some really good physiotherapy input. And we also have a tele-rehabilitation clinic. So a number of different booths where we can connect remotely with patients who are unable to get onto campus. And so this is a really easy facility to reach out and treat them, and was an excellent source in the pandemic, in the peak years. Okay. Within the physiotherapy program, there are also opportunities to do a clinical placement overseas. And so these in the past have been in Canada, Belgium, Scotland, Vietnam, and Timor-Leste. Now, this changes from year to year as to whether placements can be offered at these different regions. But these are awesome experiences where you can get to go and see healthcare practice in a different area of the world, and having that contrast between what you've seen in Australia and then what happens overseas is a really amazing learning experience, and the different needs and health conditions that are prominent in those different areas. So that's an experience that is open to you. These clinical experiences tend to be multidisciplinary, so there would be students from physiotherapy, from occupational therapy, and from speech pathology. So you'd go out there with a team of other students, and also with a team of staff to support you in that.